Hello, everyone. Welcome and thank you for joining us today. My name is Brittany Palmer. I am a birth doula and founder of Glow and Grow Childbirth, where I provide emotional and informational support before and pregnancy and during the childbirth process. I'm also mission manager for the March of Dimes' Mom and Baby Action Network, where we focus on health equity. I'm currently working on a project where I'm engaging several communities in action learning and the action learning community process, where they're actually working in collaboration on increasing access to quality healthcare. Before we get started, I want to know kind of what you all know, the folks that are here. So we're going to start with a poll. I know everyone loves those and they're super fun. So I want to know, how well do you know the difference between OBGYNs, doulas, and midwives? So I'm going to ask you to go ahead and answer the question. I'm going to take about 10 to have opportunity to answer. Your options are: one, I've never heard of any of these people, I have no idea. I've heard two, I've heard of them, but I've heard of OBGYNs, but not doulas or midwives. Three, I've heard all three, but don't know the difference between them. Four, I feel confident enough to make an informed decision about my own maternal health care. And five, to share this information with others. So please feel free to answer the poll question. And as that poll is going, I'm going to also go ahead and launch the second question, which just helps us to know who's in the room. So, are you someone who is a parent currently? Are you not a parent yet, but you're hoping to become one soon? And neither. I'm just here for the information. So we'll take a few seconds for you to answer your poll question. Get some participation. Right. Okay. Right. So almost everyone's voted. Keep voting so we can just want to know who's in the room and what you know. And then at the end, we'll see what you know and see if we've learned anything together today. Awesome. Awesome. All right. So if you look in the poll section, you can see that many of you, or most of you that have answered so far, do feel confident enough to make an informed decision about their own health. We have several folks who have heard about OBGYNs, doulas, and midwives, but don't know the difference. And a few folks who feel confident enough to share with others, which is awesome. So far, we don't have heard of any of these providers. So that's great as well. And we are kind of split three ways as far as current parents, folks that are not yet parents, and folks that are just here for the information. So that's awesome. So I'm going to introduce our panelists really quickly. I'll be acting as your moderator and facilitator of this conversation. Our first panelist is Kelly Bryan. She is a certified doula, childbirth educator, and lactation specialist. She created the Speak Life Doula program and co-authored the Safety Pin grant submission that garnered multiple awards from the Indiana State Department of Health. Kelly founded In Full Bloom Maternity Service, LLC, and Mahogany Maternity, a 501c3 that has served in hospitals, home births, and birth centers for over 14 years and established the 32nd Milk Bank Depot in Indiana. She served County Fetal Infant Mortality Review Team, the Indiana State Department of Health Maternal Mortality Review Team, the Board of Mental Health Awareness of Michiana, and chairs the Birth Equity Subcommittee for DONA International, and serves as a Director of Diversity and Equity and Inclusion. She co-founded Birth Equity and Justice SJC and has testified at the Indiana State House in House and Senate chambers in support of SB 416 was passed and is to be signed by Governor Holcomb. So that is Kelly Bryan. We're so happy to have her here with us today.
Thank you for having me.
Thank you for being here, Kelly. Born and raised in Atlanta, Melanie Williams, who joined Greater Atlanta Women's Healthcare in 2016. Ms. Williams is a board certified physician's assistant who received her PA degree from Emory University School of Medicine's Physician's Assistant Program in 2015. Ms. Williams earned her bachelor's degree in cellular and molecular biology from Hampton University in 2007, followed by a master's degree in public health from Mercer University School of Medicine in 2012. Ms. Williams is actively involved in promoting preventative health care and specializes in maternal child health. She also has a passion for serving the underserved and empowering patients through health education. She's dedicated not only to providing direct clinical care to each of her patients, but also making an impact on improving health and wellness of the surrounding community. Ms. Williams also enjoys teaching and currently serves as a clinical preceptor and adjunct professor at both Morehouse School of Medicine and Emory University School of Medicine's PA programs. Ms. Williams is a member of several academic organizations, including the Georgia Association of Physicians Assistant, American Academy of Physicians Assistant, and Association of in OBGYN. She's also a member of Delta Sigma Theta Sorority Incorporated and enjoys cooking, traveling, and spending time with family and friends. So as you all can hear, we've got some fantastic panelists here with us today. Thank you, Melanie, for joining us.
Hi, ladies. Thanks for having me.
All right. So first, I want to do a little level setting and let you know what we are here to talk about and what we won't spend a lot of time talking about. So I know that when we talk about the Black maternal health crisis, there can be a lot of gloom and doom. There can be a lot of scary stories, scary statistics. And while all that is true, what we're actually here to talk about is knowing how to make informed decisions and knowing what your options are in maternal care. So I will spend a bit of time talking on the crisis. We will not spend all of our time speaking on it. We'll spend more time learning about your options for care providers during pregnancy, the different midwives, doulas, and OBGYN providers, and what you should look for in a care provider. The last thing I want to share is, of course, we're all working from home, and so we've seen, clips and probably experienced ourselves all kind of crazy stuff in the background. I'm not at home right now. I'm doing kind of helping my cousin out with a new baby. So there's a newborn, a toddler, and a dog in my home. So if you hear crying, barking, or Moana, please just it is what it is. I've asked for quiet on the set, but we'll see what happens. And thank you for your patience in advance. So I'm going to start, Melanie. I just mentioned that we won't speak a lot about it, but Melanie, could you tell us just a little bit about what folks should know about the Black maternal health crisis and kind of where we are and how we got here?
So the kind of biggest, like you said, hot topic that a lot of people are talking about are the maternal mortality rates and the crisis in the United States. African American women and women of color are 3 to 4 times more likely to be affected or die from pregnancy-related outcomes than our white counterparts. When you look at the numbers, it's like 40 and 100,000 for our white counterparts versus 12 and 100,000 for women of color. So big picture, it's not that many people, but the biggest reason is why are our rates 3 to 4 times as more as women with the same access to care. And so I share that so that we take away from the doom and gloom of it, but educate ourselves so we know what to look for and so that we can work on different policy options and things so that we can decrease those rates. And there's so many different things that have been researched for reasons for why these rates are high. Some of them are implicit bias in healthcare settings. Some of them are lack of access to healthcare in underserved populations. Some of it is social determinants. We call them social determinants of health, or like income inequality or lack of resources or lack of prenatal care. So, we don't want to belabor so much on the doom and gloom of it, but talk about what we can do to kind of increase access. Another little interesting statistic that I just wanted to share that I looked up is that pregnancy related mortality rates for Black women with a college degree is 5.2 times more likely than our white counterparts. So it's not always for the underserved. It's not always in low income communities. There are college educated women that are affected 5 times more likely than a white woman with the exact same degree. So it's really about us coming together, knowing what our options are, and kind of addressing the issue head on.
Thanks, Melanie. While we're at it, share a little bit about the role of OBGYN providers in childbirth.
Sure. So I am a physician assistant. I do not deliver, but I work with the healthcare team. At the practice that I work at, we have 4 physicians, a midwife, and then myself, a PA, and sometimes a nurse practitioner, another advanced practice provider. And so the role of an OBGYN in the healthcare setting is kind of to be the captain of the ship along with the patient to make sure that we are making educated decisions as we go through, making sure that we're getting a good health history and making sure that we know what pre-existing conditions are there so that we can address them appropriately throughout the prenatal care process through the 9 months or so. But OBGYNs tend to work more so in the hospital setting as well as outpatient setting when it comes to delivery. Of course, there's blurred lines with all of these roles in some aspect. But that's the biggest kind of piece, I would say. The difference is working a part of a healthcare team as the patient advocate and more so the hospital setting to be there during the labor process and delivering, whether it's natural birth, whether it's an induced labor, whether it is a C-section. That's kind of the role of an OBGYN.
Thanks, Melanie. Kelly has been gracious enough to wear 2 hats for us today. So first, Kelly, would you just talk to us a little bit about the role of doulas? Like what is their role in a care team?
Yes, thank you so much. That is one of the number one questions that what is a doula? Or another question that I get a lot is, oh, so that's the same as a midwife, like a midwife little sister. So doula, the word is Greek in origin. It means servant or one who serves, and it's come to mean someone who is accompanying parents throughout the entire maternity cycle. So throughout the whole entire childbearing year. So as soon as someone finds out she's pregnant, she can locate that doula, or maybe even before actually you become pregnant, when you're trying, locating someone as a doula. You can go on doulamatch.com or other services. Do is we come alongside the family. We're learning a lot about childbirth education together, how it relates to the woman's body. How is this affecting the woman's body? What's going on emotionally, knowing where her triggers are, knowing what her birth preference is, and helping her to set up a plan, all of those things. And then teaching her how to work with her provider, how to work with her partner, and how to work with her body to learn what's best for her mentally, emotionally, and physically to have her best birth possible.
And like I said, Kelly's wearing 2 hats. What about midwifery? What is a midwife? What's the difference between a doula and a midwife?
Yes. So a doula, I'm glad you asked that question, because what I left out is that a doula is not a medical professional. We're not clinicians. We are not to diagnose or prescribe anything. However, a midwife, her role is to actually be the provider, the clinical provider, the one who is actually catching babies. So this is someone who has gone through and has been certified and licensed medical care for the labor and the delivery and, postpartum. So this is who is actually going to be performing any procedures as far as what is licensed for that state, right? So if it comes down to where there's a serious issue where there needs to be a surgery, then the midwife will the patient to the OBGYN. But other than that, if it is a natural birth that is uncomplicated and that is safe, it can be done home or in a birthing center or in a hospital. But the difference between the midwife and the doula is that the doula is not and the midwife is. This is someone who is actually charged with the physical clinical care of the mother and the baby.
Awesome. Thank you so much. So I have a question for both of you. So if some you may have heard this, some of our listeners and participants, you may have not. Some folks tend to think that there is beef between OBGYN or hospital-based providers and doulas and midwives, and that everybody's beefing and we're not working together, and there's this big, issue amongst us. But can you all talk about how OBGYNs and other hospital-based providers and doulas and midwives work together to improve birth outcomes?
Yeah, so let's say there's no beef here. I can dispel that myth. And I think one of the biggest importance with helping to decrease maternal mortality rates is working with a healthcare team. And the more people and advocates that you have on your team, the better health outcomes are. So with, OBGYNs, we work along with and we support having doulas helping mothers to put together birth plans so that they are educated on their options and can bring their birth plan into the office so that we can kind of go through them and let them know with your particular comorbidity or your health history, what things we can or cannot accommodate. And so sometimes having that doula there to help explain things a little bit more, kind of to help be the cohesion between the office setting and when you go back home. There are some postpartum doulas that help mamas once the baby has arrived, and they're helping kind of making sure that things are smooth sailing as we transition from the hospital to back home. There are midwives that work with physicians and midwives that work by themselves and for low risk pregnancy as far as the delivery process. So, I think it's important, like we said, this session to kind of tell what the difference are with everyone, but know how we work together. And I think it is important that we do work together ultimately to make sure we have safe mama, safe baby.
Absolutely. Absolutely. And again, no beef here either. We have waved the white flag for everyone. And the reason is because I think a lot of the issues that have come up in the birth world, as I guess a lot of us call it sometimes, is that a lot of publications or news media or social media as well can display stories and problems that come up, and it kind of pits providers against doulas sometimes, or it paints a poor picture of either the doula or the OBGYN, when in fact, like Dr. Melanie said, we are a cohesive team as OBGYNs work steadily and heavily to make sure those deep issues that sometimes might not be caught, or working to make sure these emergencies are taken care of and saving lives. Then, on the other side of that, doulas are to say, touch this way, she may be uncomfortable, or let's talk about an alternative word because this triggers her. So this is talking about the whole woman. This is talking about the whole mother, the whole birthing person. So being covered and making sure that her physicality clinically is taken care of, those expert eyes and those expert hands are being put to use. And the other side as well, the doula is there to say, yes, and as a matter of fact, I'm here to comfort you, I'll hold your hand. Whereas the doctor or the OBGYN may want to, or the midwife may want to, but they're on that adrenaline and they're ready to get things taken care of to save lives. And sometimes it can be, really, you have to just bear down and do the thing. And so the doula is there to say, okay, let's all work together. And on the other side of this, let's be the comfort. Let's be, the guide and things like that. And so it's a really beautiful thing when you have that cord, of three. If you have an OBGYN that's working with a midwife, if something happens and goes wrong, the midwife who is there to look at the physiological that need to be cultured and taken care of, and is there to say we can all work together this is what mom's preferences are. You know, she may not be able to speak that, but here's her plan, and this is what she has said. And, you know, let's all do what we can to make this the best for her. And so I think that it's really, it behooves us all to make sure that, you know, doulas and midwives, especially Black doulas, midwives, and OBGYNs, put out there into the world, social media, news media, that we could do to say, no, we stand together, especially Black midwives, Black OBGYNs, and Black doulas, that our team is the best team. This is how we save lives. This is how we preserve beautiful birth. This is how we uplift beautiful Black birth as a team.
Absolutely. Absolutely. Thank you both. Switching gears a bit, what would you say that Black folks need to know about pregnancy and during this crazy time that we're in during COVID-19? What, you know, if you had one piece of advice or information that you would want folks to know, what would that be?
A couple of things that I will say. Things have changed and birthing has changed due to COVID. You know, I'm going to say back in the day, there could be 3 or 4 people in the labor room, but for a lot of the hospitals, particularly in the Atlanta area, they are only allowing one support person to be there. Mamas do have to, we say, push in a pandemic with a mask on. As, you know, more people are becoming vaccinated, and, you know, some hospitals are considering lifting or at least allowing a second support person there. But some mamas are having to choose whether or not their doula will be their one support person versus their mom or their partner, significant other. So I really say, if my word of advice would be to educate, educate, educate. Come together, find support groups of other mommies that are pregnant at the same time. Go to all of your prenatal care visits, bring questions, ask questions, make sure that they're answered. Take childbirthing classes. Some of them, yet they may be virtual. You may not be able to do a tour of the hospital, but you can do a virtual tour. Utilize all of your resources so that you get more comfortable and it takes away that fear or anxiety of the unknown. So that's my kind of biggest tip, is kind of, we do so many things, educate ourselves so that when we get there, oh, this is a piece of cake. I'm just showing up to have my baby today, and I'm going to have healthy baby and do just fine. Yes.
Kelly, Melanie went over many of the things that you would probably share as well. Do you have any, what's your perspective as a doula, as a midwifery student? What do you want folks to know about this, about birthing during this time?
Absolutely, and you really hit on that really well, Dr. Melanie. But another thing to really just add on to it, because it's really just kind of an amendment, know your rights, know the laws in your state. And part of what the education that she mentioned is educate yourself on the policies for the hospital. Ask for a written policy. Ask to see that policy and know before, as you're choosing your provider, as you're choosing, your hospital, if you choose your hospital, then know what their policies are, and then know your rights. Absolutely know what your rights are so that you're able to exercise them and know what your alternatives are as well.
Awesome. Kelly, I think we're getting a little feedback from you audio-wise, so I'm going to come back to you with a question. Before I get to that, Melanie, most folks will have their baby in a hospital-based setting, right? And so they will need to choose a provider. How would you advise people to choose their care provider? You mentioned some, asking questions and things like that. What do you think folks should know about choosing their care provider in a hospital-based setting specifically?
I think there's a couple of things that come into play with that. Some of it is asking around to family and friends who have had babies and their experiences and what recommendations that they have. The next thing is kind of knowing your health history, your pre-existing conditions, and your risk. If you are high risk, you may need to see a provider who works in a hospital setting versus wanting to attempt to have a home birth, because there are complications that could arise at a home setting, and we need expedited care. So I think really kind of knowing your health history and assessing your risk, kind of deciding what you want birth to look like. Do you want a water birth? Some hospitals and some providers don't perform water births, and some hospital settings don't allow water births. So that can kind of help decide what location or that you choose, or what hospital that you choose, and also kind of your pain management options. Do you want to have a natural birth? Do you want to have the option to have an epidural or other pain management options that would require close monitoring in a hospital-based setting versus a home birth? So kind of, bringing those questions, kind of getting a plan together of what you see for your birth. And then even with plans, I always tell my patients, the babies don't read the plans. We make all these birth plans and they take it, ball it up, and throw it away. So being flexible with those plans as well, knowing that you're putting that trust and the expertise into the healthcare provider that you've chosen to take great care of you, and the doula that you've chosen to support you, and vice versa.
Thanks, Melanie. Kelly, there was a question in the chat since we're on the topic. Can you talk a little bit about home births and really briefly about coordinating something like that?
Absolutely, yes. So the beginning of that is knowing your body and understanding if there are any health complications occur that would divert you from a home birth. So if you're high risk, this is not something that you want to take on. This is something that you want to, you want to stay with your OB and make sure that you're under that care. If you're not high risk and you are low risk, like Dr. Melanie said, then the beginning of having a home, being a midwife was licensed and certified in your state that is willing to do that. And you want to make sure that their proximity is within that 45-minute hour. That their drive is going to be quick to you, and that you've set yourself up for that. So what does it mean to be comfortable in your space? Where in your home will you feel comfortable, and who in your atmosphere makes you feel comfortable? What are you able to make that space? You'll want to have movement, you want to have comfort, you want to have cleanliness, and you want a birth kit. And so you can find online lots of information about that. There's also a website in his hands that provides a lot of different products for home births, birth kits. And so just making sure that you're comfortable with your midwife, speaking with them and talking to them about your family, your desires, your needs, sharing everything that you can about your health to make sure, in fact, low risk, and that this is a good choice for you.
Absolutely. We've got a couple of minutes left, and I think that what I would like to do now is exit poll. Yes, exit poll. So I'm a recovering educator, so I'm obsessed with checking for understanding. So I am going to ask you all to let's see here. There we go. I'm going to ask this question once more. After this conversation that we've had, how well do you feel that you know the difference between OBGYNs, doulas, and midwives? I'm going to ask you to go ahead and vote. And as you're voting, I'm going to ask Kelly and Melanie our final question, which is, how can folks best advocate for themselves before, during, and after childbirth? We've got so if you all want to just quickly give your best tip for advocating for yourselves or others, that would be great.
Kelly, you want to start?
Okay, sure. One of the best ways to advocate for yourself is your body and know what that means for your pregnancy. So understanding if you have any issues that may present a problem during birth that could stop you from having the kind of birth that you want. So what are high risk, knowing what providers are able to do want a water birth, or if you do want a home birth, and knowing what your rights are, advocate for yourself very well. But then also knowing the questions to ask providers. Ask about C-section rates. Ask about how many water births have they attended. Ask questions that are close, so that you know that you're on the same path as far as what you desire for your birth as they are, as what perform for you. I don't want to say allow, because you have body autonomy. And I think one thing to know about advocating for yourself is knowing that nobody is the expert on your body but you. And so you bring your provider into that. So that is how you advocate for yourself, knowing that you have autonomy and knowing your rights.
Awesome. Melanie, any final words?
Yes, I definitely agree with all of that. And just kind of, being empowered to ask questions when you have them. Listen to your instincts, listen to your body. If, you're not feeling a certain way, listen to that. It's okay to come in to be checked to make sure that all is well. Ask questions, read, educate, speak up for yourself. I think that's the best way to be an advocate. We love our informed, educated patients that come in, and people always say there's no dumb question. There's not. We are there to answer the questions and answer them multiple times and provide reassurance and make sure that we are making you all feel comfortable. So when you get to the labor and delivery process, everything kind of runs smoothly. And then making sure you do share your health history. I had one of my patients, she says, there's two people I don't lie to. And she said, my OBGYN and my therapist.
Yeah.
And it's because you need to make sure you dispel every little piece so that we can make sure that we adequately take care of you when it gets time. So those are my added little tips.
Awesome. Thank you both for speaking with the group today. And thank you all for joining us. Head on over. I appreciate you staying for this extra minute. Have a great day. And thanks again to Gratitude for Black Girls and This Is Us platform for offering us this opportunity. Thank you and goodbye.
Bye.